Ella cuando está grabando. Hey, hey. It looks like this. Because this is charged, but it's probably. No. Good morning, everyone.
Good morning. Happy Free Friday. Hey, any sentiment to make it feel better, right? So thanks everyone for being here. For those of you who don't know me, I don't know if there's anybody in here who doesn't, but just in case. I'm Soraya Burgess Burnett. I'm the Deputy Commissioner for Children's Services Division at DFS, and I welcome all of you to be here with us today. We're actually going to start off with a really important topic, and that has to do with vaccinations and specifically measles. How many of you have heard anything about measles in America? Raise your hands. I think Dr. Sabuka is going to say, no. All right, but we do have with us this morning Chicago Department of Public Health. And Dr. Sabuka has brought his team with him, and they've got some materials, but I do want to give them the opportunity to do a presentation, because at the end of the day, you all are working with our most vulnerable citizens and our youngest citizens. And we know what can happen, and we've all heard about measles outbreaks. And the worst thing that we've also heard is deaths. And we don't want to lose any of our children. And we know that in America, we thought, and at least I know I had, for a while in my life, it was like, we have eradicated measles. And then the truth is we are now suffering through many states that have many, many cases. And so what I want you to do is pay attention. There's information that will be shared with you. What you hear today, and all of you know, we give you information, but you've got then the responsibility to definitely share it with your parents. So hear it, listen, ask questions, and then please, when you're back home, make sure you're sharing it with all of your staff and your families. So I'm going to turn it over, Dr. Sabuka. If I'm mispronouncing your name, I apologize. All right.
Great, thank you so much. Okay, so good morning, everyone. My name is Dr. Alex Sloboda. I'm the Medical Director of Immunizations and Emergency Preparedness at the Chicago Department of Public Health. So thank you for having us this morning to talk about this very timely and important topic of measles and vaccinations. I'm here with some of my colleagues from the immunizations program at Chicago Department of Public Health. I'll just let them briefly introduce themselves.
Hi, good morning. My name is Diana. I'm a nurse practitioner at the immunization program. We've brought several handouts here today. I have two about measles, and they're both in English and Spanish. And then I also provided a flyer about the Chicago Department of Public Health immunization services, what our public nurses can offer to the Head Starts, as well as our immunization clinics flyer.
Hi, everyone. I'm Paul Lucas. I am the Immunization Program Director. Hi, everybody. Seeing some familiar faces here. My name is Victor Santiago, and I am the VFC coordinator. It's good to see everybody.
All right, and while I'm talking, we'll start kind of distributing some of the flyers as well, so you can have all that information, but we'll discuss it during our brief chat. All right, and what we're talking about this morning is measles. Like was already said, there is a lot of measles cases and several very large outbreaks going on in not just the US, but throughout North America. And so, like was also said, we really want to talk about how this impacts children under 5 years old in terms of measles and how we can prevent them getting sick from measles with vaccination. All right. Here's just some of the questions that I'll cover today in this talk. What is happening with measles in the US and why is it concerning? Even what is measles? It used to be eliminated and even eradicated from the United States about 20 or so years ago. So a lot of people don't even know what measles is because they haven't had to think about it or deal with it in a very long time. What is the MMR vaccine and when should children receive it? What is the MMR coverage looking like for children under 5 in the city of Chicago? What can we do to protect our young children in Chicago from measles? Where can children get vaccinated? And how us at CDPH can support Head Start programs in measles vaccination efforts. So I'll kind of go over a few of these things. And then we'd like to open up to some questions as well. All right, so this is currently what things are looking at as of last Friday. But really, over the past 3 weeks or so, we've had over 100 new measles cases per week in the US. So this is really not slowing down, which is the concerning part. So as of last Friday, the CDC reported 712 measles cases in the US this calendar year of 2025. And it's now over 25 states and jurisdictions. And you can see in the map here, a lot of this stems from the outbreak in Texas, but it's also spread to New Mexico, Oklahoma. There's cases in Kansas. There's also a growing outbreak in kind of Northeast Ohio area. And particularly, like, what does this number even mean? Is this a concerning number? I'll go over some graphs, but before the vaccine came out in the 1960s, there would be hundreds of thousands of cases of measles. Like it was just like a normal part of life. Kids would get measles, and some kids would die from measles. Hundreds of kids would die from measles every year before the vaccine came out. And then through vaccination, these numbers really just completely dropped off. And then eventually they added a second dose and even decreased the numbers even more. But this is in the last 30 years, the last 3 decades, this is only the second time we've ever had over 700 cases of measles in a year. And we're only in April, so this is not a good trajectory. As you can see, 32% of cases are in children under 5. 20% of children under 5 that are getting measles are having to be hospitalized. And as you can see, 97% of cases are unvaccinated or they just don't know their vaccine status. And like we've already talked about, unfortunately, 2 children have already died from measles this year, and they were unvaccinated, unfortunately. So kind of like I was talking about, just kind of taking us back, you can see on this graph, there's hundreds of thousands of cases, even more going into the 60s. In 1963, the measles vaccine came out, and just like look at this drop. Within a couple years, we're down to under 100,000. Throughout the 70s and 80s, there'd still be some kind of waves in the kind of tens of thousands, nothing like before. So then eventually by 1989, they introduced the second dose of the MMR vaccine. And then that really just kind of got rid of it for quite a while. In the year 2000, because of such strong, we'll kind of talk about the Vaccines for Children program that came out of the 90s, specifically because of these outbreaks that were happening in 1989, 1990. Congress created the Vaccines for Children program So there would be no access barriers for children to vaccine. And so in the 90s, because of the Vaccines for Children program, we got elimination status by the year 2000. And since then, it's been looking pretty good. There'd still be cases of measles. Typically, unvaccinated person would travel abroad, get exposed to measles, come back, be infected. But because vaccination rates were so high, measles had nowhere to go. So it would just be a case and it would be done and it would be contained. There wasn't really outbreaks. Like I said, in 1990, there was this, and there was a ton of cases. This was kind of the last big outbreak in Chicago before the one we had last spring, was in the 1990s. And there were tens of thousands of cases. But like I said, Vaccines for Children program, second dose of MMR vaccine, they really just squashed measles. And then because of some declining vaccination rates, we started to see these little upticks. So 1994 was the last time, the second to last time there was over 700 cases. There were about 1,200 cases in 2019. A lot of this was, there were several large outbreaks in New York City that you may remember among close knit communities. And then now in 2025, we have 712 cases, but we're only just over 3 months into the year. So this is concerning. All right, so why is this even happening? Part of it is because it is the consequence of the COVID-19 pandemic globally. Obviously, we had this huge public health emergency. We had to mobilize all our resources. We had to focus on the emergency, but that did take away from preventative and primary care. So a lot of kids weren't able to go to the pediatrician and get their vaccinations, or there just wasn't enough resources going into just routine pediatric vaccinations. And this is a global situation as well as across the US. It's not just the US or Chicago, it's happening everywhere. Obviously, many of us are aware that there's a lot of vaccine disinformation and misinformation going on, which has increased vaccine hesitancy and mistrust, unfortunately. All right, so that's kind of the situation, but even kind of stepping back, what is measles? So the biggest issue with measles, it is very contagious, which means it is very, very easy to spread to other people when you're infected and sick. It does spread through the air, which is the most concerning part, and it can stay in the air for up to 2 hours. So someone with measles, if going to a clinic, they're at a daycare, they're at a school, and then they're sick with measles, they cough it out, and then that measles stays in the air for 2 hours. So somebody might have no contact with that person, but because they went through the same hallway or the same room as them within 2 hours, they could get measles. But this really only happens when you have no immunity to measles and you're not vaccinated. So when someone's sick with measles, when they come in contact with 10 people, 9 people that are unvaccinated out of those 10 will get infected with measles. It really is the most contagious virus that is really out there. Classically, you can see in this cute picture, but a child with measles, a flat red rash. But it usually starts with a fever, cough, you get that red eyes, runny nose, is usually how it starts. And then within a couple days, the rash breaks out, usually starts on the head, and then kind of goes down the body. But even before they break out with the rash, they can infect other people with measles. The other big concern, not only is it very contagious, but it does cause severe disease. And as we can see, sometimes people can die from it. When it causes severe disease, it can cause lung infections, brain infections. Before the vaccine, it was one of the most common causes of deafness in the US and in the world. And it can cause a lot of long-term complications. So even if you make it through measles, you're hospitalized, you get really sick, but because of good medical treatment, you make it through, there could still be long-term damage to your body, your lungs, your neurological brain function, your immune system can also be permanently damaged as well. And in particular, it's dangerous to very young children, which we'll talk about. So how do we prevent measles? The answer is MMR vaccine. It is a very effective and safe vaccine. As you can see, the measles vaccine has been out since the 60s. It was combined with measles, mumps, rubella. So those are three different viruses. They were packaged together in like 1971. And that's how we got the MMR vaccine, so that we didn't have to get three different shots. It's three vaccines in one shot. One dose alone is 93% effective in preventing measles, and then two doses is 97% effective, which is probably the most effective vaccine that's been ever created. It's very good. Like I said, measles vaccination started in 1963, the combination 1971, and particularly because of how contagious measles is, it's very important that we have very high levels of vaccination. Because if it drops just 1% or 2% under 95%, measles is going to sneak in. So it's very important to get these and keep these coverage rates above 95%. And that's how you get this thing. A lot of people learned about herd immunity during COVID, but this is really the immunity level of the community someone's living in. So it might be a school, a daycare, a city, a neighborhood. And as long as that vaccination rate is above 95%, it's very unlikely measles will be able to sneak in. There are people that can't be vaccinated, particularly, especially children under 6 months, but typically children under 12 months. It's too young for them to get vaccinated. Also, people might have medical conditions, immunocompromised, immunosuppression, things like that are so severe that it's not safe for that people with that type of immune system to get vaccinated. So that's why it's important for other people to be vaccinated, for people that can't. All right, so what is the typical MMR vaccination schedule? So the first dose is recommended to be given just after the first birthday at 12 months of age. And then the second dose is typically given at 4 years of age. They do give a window of 4 to 6 years, but it's really important to try to get it as soon after they turn 4 as possible. There are certain situations of where it's perfectly fine to get the second dose 28 days after getting the first dose. So when we had that outbreak last year in the shelter, thankfully the whole city of Chicago was able to respond promptly. We really shut that outbreak down to only just about 50, 60 cases, thankfully. But during the outbreak, we were giving second doses 28 days after the first dose because it's still safe. It's going to have the same long life immunity. But usually they just wait to 4 years just to kind of fit into the normal schedule, but it can be given 28 days after the first. It is part of the IDPH measles vaccine requirement. The minimum immunization requirements entering a childcare facility or school in Illinois from this past school year. So it is a requirement for childcare facilities and for schools in Illinois. We're going to have the slides sent out after this to everybody that attended. We have a lot of good links in here. So here's a link to those requirements by Illinois Department of Public Health for childcare in schools. We also want to stress that there are, particularly for children traveling internationally, because that's kind of how cases and outbreaks starts. Someone unvaccinated travels abroad, gets measles, comes back, exposes other unvaccinated people. So children 6 months to 12 months can get an early dose. It's not part of the normal. They still need their normal 2 doses, but they can get an early dose to get them a little bit of protection if they need to travel 6 months to 12 months, or if they are over 1, they should get 2 doses within 28 days. Here's just kind of a map of, this was 23, 24, looking at students entering US kindergartens and their MMR vaccination coverage. And you can see we want to get to this 95%, but not many states are at that level. Illinois is even between the 90 to 94. Before the pandemic, this map is obviously a lot more blue than it is now. Now we're seeing a lot of this like lighter orange, and even this less than 90%, this really dark orange, which is concerning. Here's some numbers for measles protection among kindergarten and pre-K. So when someone enters kindergarten in Illinois or Chicago, they should already have those 2 doses because they can get the second dose at 4 years of age. And people in pre-K, particularly if they're over 12 months, should at least have one dose of MMR vaccine. So looking at the past couple years, when they're entering kindergarten or pre-K, these levels are definitely not near 95%. But we saw, if you go back a couple years, the start of the pandemic, they dropped off. But thankfully this year, we're finally on the upturn trend. And even throughout the CPS system, they're saying that they're, at least district-wide, they're back over 95%. There's still a lot of schools that haven't gotten quite back up to 95 yet. All right, so how to prevent and respond to measles? Obviously, the only prevention that works is the vaccine. But what are some other things we can do? Here's a nice link to the Head Start website, a specific page on measles. Gives really good information for Head Start programs and sites about measles, how to prevent measles at their facilities. Other important thing we want to stress is it's super important that Chicago Department of Public Health knows about a measles case as soon as possible. Just because it's so contagious, it spreads so quickly, and there are things that we can give people that were exposed and not vaccinated. If we're able to get to them within 3 days, we can vaccinate them, and then that should hopefully protect them, even if they were already exposed. Or if there's certain groups that can't be vaccinated, we can give some antibodies basically to them to help give them some protection, so hopefully they don't develop an infection. So a lot of times we'll know about the case, but it's really important for Head Start or childcare or schools to reach out to us, so we know that that child goes to that site, and then we can start to do our evaluation to see who is exposed and who needs, who's already vaccinated or who's not, and kind of go from there in terms of getting some post-exposure prophylaxis vaccine, or if somebody might need to stay home for a while to not expose others. This is from the Illinois Child Care Act, section 4.6. I put a link in there, but child care facility employees that care for children 6 weeks to 6 years are required to have 2 doses of MMR vaccine or proof of immunity. So it's really important as well that people working in child care facilities have these 2 doses. It is part of the Illinois law. So either having documentation of 2 doses of MMR vaccine, or sometimes people will get what are called titers or antibody levels, and that will show, yes, this person has immunity against measles. Here's just like again, here's the numbers to call if you're told that you have a case of measles or there's any sort of measles concern. Please reach out to us. Here's the day timeline. If not, if it's after hours, just call 311. Here are some vaccination options. So we're passing out some flyers about our caravan, which is a great opportunity. We do have 4 immunization walking clinics. There's a couple not too far, a bit far, but not too far from here. We just opened up a site in Roseland. There's also Greater Long West 55th Street, but there's also one in Uptown, as well as Pilsen, South Ashland area. So kind of spread throughout the city. But so that's just a good resource for parents and guardians. They need to take to get their kids up to date. Otherwise, there is the mobile caravan. There's a link here to request form if you would like the caravan to come to your site, either to provide education to staff or parents, or to actually have a vaccine event. Other option is we do have the Vaccines for Children program, which is what Victor oversees here in Chicago. We have over 300 VFC providers that are enrolled in this program and that we work with and support. This provides no cost free vaccines, all the routine and recommended vaccines for children 0 to 18 years. And eligible children, it's really anybody that doesn't have private insurance that covers all the costs of vaccines. And so there's if a child is on Medicaid or CHIP, even if they may not have it, but they're eligible for it, it's still covered by VFC. Obviously, people that are underinsured, and also specifically American Indian, Alaskan Native. All right, so kind of what we are here to talk about today this is kind of the situation. This is what things are looking like in Chicago. Thankfully, we have not had a case of measles this year in Chicago or in the state of Illinois, but we had that outbreak about a year ago. So we just really want to be prepared because we don't want any cases. And if we do have a case, we don't want an outbreak in Chicago, particularly at daycares, childcare, early childhood learning centers, pre-K centers. We really want to make sure they're safe and protected. So here's some things that we can partner on. Evaluate Head Start program vaccination data to identify sites with lower measles protection rates. Obviously, we can provide education materials and resources. We can support in communication and messaging for staff, parents, and guardians. We already have draft letters, or we can help Head Start programs with messaging and communication with staff, parents, and guardians. Like we said, we can provide on-site and in-person education with our Caravan program. We also have some public health nurse educators that can come out, educate staff, parents, guardians, and then obviously connect with vaccination sites like BFC providers or clinics, or even schedule mobile events at Head Start program sites. Here's our contact information. Like I said, I think we're going to send this out to everybody that was here today. But here's our email addresses: myself, medical director, Paul Lucas, our program director of immunizations. Diana is here, she's a nurse practitioner that oversees our direct services. And then we have Victor, who oversees our vaccines for children program. Here's just a nice page of some of the links and resources. This is just kind of the outbreak case counter from CDC, measles page for Head Start. This is the minimum immunization requirements for children in childcare and schools in Illinois. This is the measles school on, but also useful for childcare facilities and Head Start programs from CDPH. Here's the website with all of our clinics, the Caravan event request form. Here's a finder. So if someone wants to go to a BFC provider in Illinois or Chicago, they can find the closest one to them as well. And here's just immunization resources from the Illinois chapter of the American Academy of Pediatrics. There's a lot of good stuff that they provide as well that's applicable to Head Start programs. All right, so that's kind of what I have for today. We passed out some resources. Happy to take maybe a couple questions as well. And then we're looking forward to definitely hearing from you and partnering with you all on how we can make sure that all the children that you're serving are protected from measles, and also just making sure that parents, guardians, staff are getting correct and accurate information about measles and about vaccination. Thank you. Yeah, that's a good question. So she was asking about, we have a lot of new arrivals, newcomers coming to the city, children that may have not been able to get pediatric vaccines prior to getting here. So there are like catch-up regimens, but basically if they've never been vaccinated, they can get their first dose. Usually within 2 weeks, they build up strong immunity against measles. So like that first dose, like we said, is 93% effective. So they should start seeing that 93% effectiveness within the 2 to 3 weeks. But particularly if they're already over 4 years old, 28 days later, they can already get that second dose. And then again, 2 to 3 weeks later, they're getting to that 97% effective protection coverage. Yeah. Like vaccine records? Yeah. Yeah, no, that's a good question. So that's something we've been working a lot on, is we have people coming from all over the world, a lot of different vaccine records in different languages. And so, yeah, I mean, I think a medical person should be evaluating those. We'll definitely take them if they're appropriate, but definitely a healthcare person should evaluate those and make sure they're adequate coverage. I don't know, Diane, if you want to talk a bit more about evaluating.
At our immunization clinics, we are able to interpret the international records, and also our delegate agency, ICAP, also provides us with a resource to help assist interpreting international records.
Yes, they're on the, on this link here, they have like a nice, toolkit that they made, that goes over like all the vaccine schedules for almost every country in the world, and then like what are the different words and stuff for like measles and mumps and rubella and things like that. But if there's any concern, definitely have them go see their healthcare provider, or they can even come into our CDPH immunization clinics. We'll review their records. And if everything is good, we'll actually put those records into iCare, so they're in the system if they go anywhere else. Or if they need a certain vaccine, we'll get it for them. And especially if they come to the clinic, or if we're going to with the caravan, we bring all the vaccines that they need. So all the vaccines that are required for school and childcare in Illinois, for CPS, we bring them all. We evaluate their entire record and see which ones they are eligible for and that they need. So it's not just the MMR vaccine. Obviously, we're just kind of focused on that right now with what's going on. But we want to get them update on everything that they need.
So if we come across a parent who is not open to vaccination, maybe has some missing information, how do you recommend that we have that discussion?
Yeah, I mean, we're on some of these links is some good resources about how to talk about this. We're also happy if you're having issues like that at your sites or your facility. We're happy to either come out in person and do an in-person education, or if there's someone in particular, I don't know.
So that flyer that I distributed that has that caravan picture, we do have 3 public health nurses that can come to your facility and provide education on the recommended vaccines, as well as why they're important, dispel any common misinformation that you're hearing from. Yeah, and we're also, we can speak to them as well. But if you want to actually host an event where we provide that education and then potentially also a vaccine event, we can do that. So if you just want to reach out to any of those, the email addresses on that flyer that have that caravan picture, we're happy to come to your facility.
So there's, the flyer, which has our 3 public health nurse educators for the ones that are actually going out doing these discussions, providing the education in person. We also have Diana, and then our head nurse Anna, email addresses here. So if you're having any issue with like that, please reach out to us and we'll help you find the most appropriate solution. Then either have a discussion with that parent or providing education sessions for parents in general. So just reach out to us.
Zenobia, you're next. Yes, ma'am.
Okay, I had a question, for like the adults that we want to hire or volunteers that don't have evidence of their child records, what's the best motivation for writing that where they can't find the records?
In turn, like the recommendation for.
For adults, like if someone we want to hire or volunteer, they ask if they're our adults and they don't have records, have some child with
Okay, I mean, I'm not entirely sure what like the Head Start DFSS policy is in terms of hiring. It is the state requirement that they should have these vaccinations. Obviously, we could, if they're open to getting vaccinated, that we have, we also, like we talked about, we have our walk-in clinics. We do thankfully have enough MMR vaccine for anybody in the city of Chicago that needs it. If someone has insurance or that covers vaccine, we do prefer they go to their pharmacy or provider to get it. But if they're not able to find it or their insurance doesn't cover it, we do provide to adults and children MMR vaccine for no cost at our immunization sites. So that's one option for them. They can also talk to their provider if they want to get that titer lab test that can show if they're like, oh, I know I got vaccinated when I was a child, I got 2 doses, but I don't, I just can't find the records and I'm not from Illinois, it's not in the Illinois state database. Then they can go to their healthcare provider, get the titer test. And then if they have the antibodies that show immunity, then they're good to go. So it's either it has the requirements, usually it's either they either have their records for those 2 doses or they have some other proof of immunity. A lot of times it's those antibody titer tests as well as acceptable.
And they get the test here.
No, we don't do the blood test at our clinics. I mean, any primary care provider should be able to do those tests. I mean, we can share, we do have like a very comprehensive list of FQHCs that we work very closely with. So that's where we usually refer people as to a federally qualified health center. So we're happy to share a list of those because we have them kind of breaking out by region of Chicago. But yeah, they'll have to go to usually, sometimes they can even just call if they have a primary care provider. They're like, okay, I'll order it, just go to the lab, they'll draw it. It's usually how it goes.
They are, in answer to the question of our requirement, they must be vaccinated or show proof. And you should not hire anyone who can't, especially now. And it's always been that rule, but especially now, you want to protect yourself and your organization. And so make sure that individuals, if they can't produce, especially if they're born after 1950.
Yeah, so if they were born before 1957, just because measles was everywhere back then,
We all
they
know.
are assumed to be immune. So that's like the CDC has very like specific guidelines of like what qualifies as immunity. So born before 1957, you are good to go. You can still get vaccinated if you want, but you're not required to. If you were born after 1957, most people need 1 dose, but for specific jobs, like you work in a healthcare provider environment, or you work in schools or childcare, that is where you need those 2 doses. But obviously, if someone's had measles themselves, then they can also either get like medical records, or they can get that lab test as well that also have antibodies because they had the disease. Or if they thought they had vaccinated, they can find the records, they can still get the lab titer test for antibodies. And then if that is positive, then they're good to go. Sometimes you might have been vaccinated, but you might not have the antibodies show up. And so those people might need to be revaccinated again. So that's. Yeah, so we can definitely send all of our resources. We also created a lot of healthcare navigation resources last year during the new arrivals response. And so we have a very comprehensive list of all the FQHCs, Cook County Health sites that provide care for people without insurance. So we're happy to share that list as well.
Thank you. And that's one of the, to your point, yes, there are some, 1 second, Ms. Zenobia. Yes, there are some individuals who Ms. Zenobia, let me finish. Ms. Zenobia, let me finish. Let me finish first. I'm sorry, then I'm gonna come to you. It's me now, and I'm gonna come to you. Okay, go ahead, Ms. Zenobia. It's not that, it's work with her. I work with the different.
In this case, it's going to be the determination of whether or not there is a need for the MMR. There is a questionnaire that can be completed. So we are saying today that irrespective of a questionnaire, all workers from the birth program through 6 years old should have proof of 2 MMR immunizations. That's all I wanted to.
Yes, so if you were born before 1957, you're good. If you were born before 1957, you're okay. If you're born after 1957, then you need to either show vaccine records or the lab blood test showing antibodies in order to meet the requirements to work in childcare in Illinois. Yes.
Yes, ma'am.
Yeah, that's a really good question. So, yeah, so she asked if there's a child that thinks they were vaccinated, but they just can't find the records. They were there from outside of Illinois or outside the country. We do have, I think, some data sharing agreements with some states. I can't remember specifically which ones. Because every state is supposed to have an immunization registry. And so we've started to try to share between the states, but we at least, if they got vaccinated anywhere in Illinois, in the last like 20 years or so, they should be in there. But if we can't find them, and we just can't find any vaccination records that meet requirements, then they may need to restart the series, and that's perfectly fine. It's not gonna harm them to get revaccinated with the vaccine.
The only thing I was going to say is just a reminder, and the doctor has also said it, they have to have the vaccines. Your staff, if you're looking at licensing, if you're looking at Head Start requirements, if you're looking at ISB, they all say the exact same thing. That staff in programs that are caring for young children are required to show that they have the immunizations. If they, like myself, were born before, the assumption is I had it, I did. But at the end of the day, I could still be required at some point to go in and do titers if someone wanted to make sure. And I could do that same thing for myself if I wanted to do it. And some people are doing that, just so you know. Some people have just elected to do it because they want to make sure, especially as our population ages. Okay. Any other questions?
Yeah, so here's the two links about the actual requirements, but it's either 2 doses of MMR vaccine to work in schools or childcare, or a proof of immunity, and it gives specific definitions of what that means. The most frequent one is those blood test titers as proof of immunity, or just they actually had measles themselves, but they need actual documentation medically.
Right here and then.
Quick question, is there a mail-in or over-the-counter online type of test that you can do, or do you have to go to a medical provider?
Yeah, I mean, I think for the most part, you need to go to a lab to have the blood test drawn. Yeah, it has to be a blood test for one. So it needs to be drawn. But yeah, a lot of times, if you do have a medical provider, you can just call them up, they can order it, go to the lab. But we'll also provide some resources, particularly Cook County Health and FQHCs, people can go if they don't have insurance or are underinsured. Or Medicaid as well, where they can go and get the test done.
But so, religious exemption, that's no longer honored for reasons.
There, for children, there are religious exemptions in the state of Illinois. Thankfully, compared to a lot of other states, it's a pretty small portion. It's maybe like 1.5% or less. In Illinois, we don't have philosophical exemptions like a lot of states have. So our exemption rates are actually pretty small, which is helpful. Total with all the different exemptions, it's usually less than 3%, at least in like CPS and stuff. I don't think in terms of like these requirements for employees, I'm not sure about the religious exemptions. But I can check on that.
It would take a lot of, it would take for a religious exemption over something like this, especially working in this field. It would take a lot to come up with a reason that a doctor would say yes to that.
So there's,
If somebody ever claims, let's go back to the kids, if somebody here claims, they don't have to. They can never go with it. There is official document.
Yeah, there are official documentation. So if that ever comes up, you can also reach out to us as well. We can make sure it's like appropriate documentation and meets the requirements and things like that. Thankfully, that's not too common in Illinois and Chicago. obviously it can't come up, but there's like very strict requirements of like the documentation and who's writing this and the reasons. They can't just say it's against my religion. They have to like give specific reasons. Like their religion why this is not regulation. So yeah, if there's issues with that, just reach out to us. We can help you figure it out.
Thank you all again,
Thank you for having us. Please reach out for anything.
and we will. Thank you. What we've heard is that we want our children vaccinated. What we've heard is our staff have to be vaccinated. What we've heard is we need to make sure that we get information out to our parents. CDPH is willing to come and do immunization events. They're willing to come out and do parent education. They're willing to work with us, and that's what we need right now, is to make sure people are getting the right information, because we know, as you started off with something, Zuli, that there is some wrong information out there. We need to clarify and verify and make sure that all of our families understand what the needs are for their children to keep them healthy and safe. And so again, I want to thank you guys for this presentation and all the resources and materials. We have the deck will be shared. You have some resources, any other resources. We have some other additional copies at the back as well. So let's give them another round of applause. I only have a few things, and I apologize, and I'm going to need to leave directly after this and head to the office, so I will give you guys a chance now to give me any questions before I walk out the door. One of the things people have been waiting to hear about is our follow-up review. Our FA2 review, we did have 2 findings. We had 1 deficiency and 1 area of non-compliance. We did our follow-up review, and the report says that they both have been corrected. So give yourselves a round of applause. So all of those times that the staff were calling saying, put your data in, that's the result of us working together. So thank you. One of the things that I need, and I know we've got Ken who's going to work with me, I need to get all of the leadership and key staff at your organization's updated emails. How many of you have any email that ends with AOL or any of those other endings on the end of your emails? We're going to need to work with you, as you heard the last time when CPS was here. When we're talking about organizational emails, yours, AOLs, the other .coms, they're not going to go into the system where you have to report your pre-IPT scores. And so we will be hosting some workshops to help you move from those emails onto platforms which will offer you much more security, number one, but you will have email addresses for your agency that then will be able to port directly into their system without a problem. Okay, so we are going to be sending out something needing to get from you your current email addresses so we can then determine exactly who all we need to work with. In order for this project to start in the summer, we need to get these things done quickly. Any questions about that? All right. We're wrapping up Month of the Young Child. I want to thank all of you. Thank you to those of you who've already hosted readers in your centers. Hearing nothing but good things from those who've been out. We've had senators, we've had alder people, we've had some other community representatives come out and spend time in our child care centers. What we're trying to do is just lift the voice to everybody that we possibly can about your great work. And one thing that does it is having someone come in and be with the babies. It's hard to walk away from that and not understand why we need to keep this money, right? So we do have a few more, I think there are 4 more before the end of the month, Month of the Young Child. We moved from Week of the Young Child, we decided we do Month of the Young Child. Why not keep it moving, right? And so again, I thank all of you for collectively, those who said yes, and those who hosted and those who will host. We need to keep everyone's eyes and ears on what's going on out here so that they can be part of the voice for us in saying the money is needed, the money is needed, the money is needed. give you some application updates. The application launched on April 8th. For us, there are some other numbers, but for us home visiting, there were 87 families that requested home visiting. There were 334 families who requested infant toddler programs and an additional 1,054 that requested preschool classrooms. And so the numbers are going up. I thank you. All of our marketing campaign is, is faring out where people are actually going in and applying. So on the other side of that, though, they come in, they get something that says your offer has been accepted, then they come to your door and you have to say what? Welcome. We're so happy you want to be here with us. Well, you know what? I don't have a vacancy today, but guess what? You selected me and I want you as part of my family. So let's work together with you. Let's get you in here. Let's get all your documentation. Let's get you and your family ready and prepared for that seat that's going to be available. I'm saying all that to say that's not what people are doing. What I'm hearing, and I get calls and I get emails, Sheree gets them, we all get them, where parents have gone to a door and staff at the front of your organization and said, we don't work with Chicago Early Learning. Okay? That letter you got don't mean nothing. Is that what we're hearing? You need to go talk to somebody else. We don't have no vacancies here. I'm only saying what parents are saying, and they're being very vocal. We had one mother who went home and told her husband how she was treated. And he got up and came to the center and was an angry man. And he had to be talked off the ledge because he felt that she had gotten unfair treatment, that we had lied, that we're not being honest. It only takes one, people, and we got to not do that. We cannot receive people that we shouldn't be receiving them that way, whether it's application or not. But we've got to have an open door, and we've got to have staff at the front who understand they are the front of your business. And if one person said that, she probably talked about it at dinner. She probably got on social media and told everybody that she know, girl, don't go over there. Is that your marketing campaign for your organization? I would hope not. And so I'm saying that to you, that we just launched another application and we don't want those messages out there. We want people to receive individuals, even if you don't have a vacancy that day. You can start working with the parent. You can do their ASQ. You can talk to them about what those scores are. You can walk them through your center, talk about what you're doing in early learning. You can tell her you can come and visit. There's all kinds of ways to make a person feel that you really want them to be a part of your family. It's really easy to turn somebody off. And if you turned them off, you turned off a child. Let's not do that. It launched. People will be getting their offer letters. They had an opportunity to choose 5 programs, so it wasn't just you. And so if they got one and it is you, be loud and proud about you want to be here with me and treat them that way, please. Can we all give ourselves a round of applause that that's what we're doing this year? I had a person who came to me at 16, 15 because she wanted to make sure she could put a face to a name because she had got my name from somebody. She still didn't enroll her program, her child program. She said, because of how I got treated, my kid will wait till 5 and they will go to kindergarten. Is that what we want? No. I couldn't talk her off the ledge because she had been insulted. She felt we were misrepresenting and she wanted to say what she felt she needed to say. There was nothing I could do, and I hate the fact that that baby now won't get the services that they need. So let's not do that. Okay? Yes, ma'am.
Therefore, I need to get that early, the birth to 3 off of the website, so then they can start getting those exception letters.
So you don't have any 0 to 3 at all? Okay.
Not programs, anyway, I only have actually 2 practice.
Dr. Craig Zemke sitting right there.
Okay, all right, great.
Okay.
Yeah, that's our issue.
Thank you for that. Yes, ma'am.
I might be opening the can.
Don't open up the seat. Go ahead.
We
Did already, so go ahead.
would never,
I know you would.
but I have like a two-part question. One, does CPS accept non-potty trainers? And two, if it's in our center policy, that you must be potty trained. And a lot of these people coming from the education are not. And we work with them and hold their stuff until they're potty trained. And we have to allow them into clubs, even though we don't have to change anything. Into school classes.
How old is the child? Do we have 3-year-olds who are not potty trained?
Yeah.
Which is normal. I mean, we see this, but we can, you have to, let me say this. If you have a child who's 3 and isn't potty trained, they're in pull-ups, they're not in diapers, right? And it's called social support. And we can work with that child to move that child from a pull-up into regular undies. We can talk a little bit more about that, but if they're 3 years old, they're in pull-ups, doesn't require the same thing in your classrooms. Does require social support to move that child forward. And I will tell you, many of our children are at home with moms who are frustrated, tired. They're probably not the only kid trying to move that child to potty training. Wasn't gonna happen before 3. Okay, and we don't want them to wait until 4 to come to you, still not potty trained, because mom still couldn't work with them. Okay, and so if there's something going on with the child and we can diagnose it, that's why we need you. That's why we need that child in care. Okay. I mean. I realize that in her statement is that some children are being turned away because the family doesn't meet all 3 funding streams. How many of you are living in that world and that's the only way you'll enroll? I know you're not gonna raise your hand in front of me. And I do know it's happening. I know it's happening every day. Let me ask you this question. Having been on the other side, it took a lot of work for me to work with my staff as well. I've got $500 in one hand and 0 in the other. Which one do I really want? You can't have the 500 if you don't enroll that parent, right? If I come to you and I don't have access to CCAP right now, it's probably because I'm not in school or working. I can't go to school or work because my baby's not in care. So family support staff have a responsibility to work with mom and her goals to get her where. And you can do a transition plan with mom. And you can say, this is what we're going to do. Then you have, if you have PFA and you have Head Start, then you have at least 2 funding sources. I know you want the 3rd. I will tell you that the number of families that are getting CCAP has decreased in Illinois. Everybody's trying to figure out the why behind it, but it is true. Fewer parents are getting CCAP. Fewer of you are getting it on every child. And if you're living in a world where that's the only way you enroll, no wonder you're under-enrolled. Because you're giving up something for something. And I will say, and I said it to my staff, show me the value of saying no to a parent and leaving a seat vacant. And they weren't able to show me the value. And I said, okay, so what's your job? Enroll. And if a family support staff is turning a mom away, I'm going to give her a corrective action plan where she has to work with that mom. I'm going to just give her that one mom because I'm sure how to do it. And get her to work with that mom to help her set a personal goal. Have that mom come in and do follow-up meetings. If the mom doesn't follow through, then you have every right to say something different. But the majority of them will, because their reason for not being able to be in care is nobody's caring for their baby. Right? And that's what we're here for. That's why we want all funding streams out there in the community so we can do this for our families. But if we're turning them away, you're turning away money. You're turning away money. And I know that's not what you want to do, but I need you to talk to your staff and strategize. One thing I will say to you is look at each and every one of your classrooms. If it's a classroom of 17, what is the total amount of money you need to operate that one classroom? And you might need only 15 with 3 funding sources, which means you can enroll what? two who doesn't have CCAP. If you look at it that way and you do your budget that way, you can figure out how to make this work. But if your standard is no, we just don't take a child without CCAP, you're turning away families. You're not going to get your enrollment there where it needs to be, and you're losing more money by saying no. Does that make sense? If anybody wants me to come and work with you on it, I'll do it in a heartbeat. Okay, because there is a way to make this work where you don't have to turn those families away. Yes.
So you don't want to turn away a family in need, even if they don't have housing. And that's where experienced homelessness families, sort of, you don't see as much enrollment because of some of those critical in-house.
And we really need to reconsider those policies considering what we're going through right now. Right? Yet, in order to meet your enrollment, you got to have a strategic plan behind your enrollment on how many children you need to enroll and what your budget looks like. And you may be shocked at how much you can get for two versus waiting on the other one. And so, but at the end of the day, to Ken's point, Head Start should be your number one if you got a Head Start, because it's the lowest income level. And you got to do your strategy to make sure that parent's even eligible for that, right? Then you're going to look at them as they're Chicago resident. Then you're going to talk to them about CCAP eligibility. They may or may not be eligible, may or not be working, may still be homeless. And what is homelessness to one person is not homelessness to another. Parents will tell you, oh, no, I'm not homeless. Well, where do you sleep at night, baby? On my cousin's sofa. Well, where your baby sleep? Well, you know, we got a nice little pallet on the floor. Baby, you're homeless. And it's okay to say that. And people don't want to use those words because it's uncomfortable, right? But you need to talk to parents and help them understand why you're there. You're there to not only enroll the baby, but you're there to work with the family, right? To change that trajectory for the entire family is what we do. Any questions about that? And again, I raise my hand. Anybody wants me to come and work with you on your budget, just let me know. Any other questions for me before I have to head? Anyone? Any questions for Sarah? Yes. On the side over there. You're gonna catch me on the way out. Okay. Yes, ma'am.
I feel like
That's why I'm trying to get out of here to get to the office. I am on my way to the office. My assistant was on her way here. They called and asked her to come back to work on the document for a meeting that we have later on today with the mayor's office. So let me get back there and I will have more information to you on your contracts. Okay? Anybody else? Yes. Does what? Does those every federal dollar. We haven't received anything regarding PFA, but remember, all dollars start at the federal level, sift through the state. Okay, haven't received anything that specifically said that. What state do we live in? What color is it? Did I say more? I'm just being honest with you, so y'all gonna make me get in trouble. Yes, ma'am. Are we looking for another pure contract? I'm going to answer that question. What's most important to you? I'm gonna tell everybody when I get to the office. They said contract. What I'm working towards is not letting anything lapse while we're making decisions. So working on the front end, because like I tell them, you can't get to the back end if I don't fix the front end. So, but we have to make sure that everybody has the right language and information. We have a new acting commissioner, and I need to give her all the language that she needs if she's going to a meeting. Yes, sir.
Do you have any updates about the situation?
That's why I said, let's get y'all questions out while I'm still here. So, and that's Kurt's question is, do we have any updates on regional office closures? We know they closed. We know the ones in what color states? Y'all said that, not me. Or the ones that did close. Have we received anything on where we are being consolidated to? Because that's the message that we got is they are going to consolidate 5 into the other 5. We've not received that. I was able to give you a follow-up review message because all of a sudden in my email box was my follow-up report that we've been waiting for weeks on. Came from somebody. You didn't generate it, so I know somebody's working. So I do have on my schedule a 1 o'clock regional meeting that was never taken off. So one of the things while I'm at the office, I'm gonna sign on to it, wait to see if anybody joins. I do know from a meeting that one person did that and someone did join. So I'm not gonna take anything for granted. I'm gonna join it and I'm gonna wait. And we'll see what happens and if they will answer any of the questions that I think, and I've got a list. But right now, we are just as out there as you. We're not getting clear, concise information about it. I will say that there was information, and I don't know how clear I'm gonna make this message. But there was a message and there's a document, there's a report where our president said Head Start's not in his budget. Anybody's heard that, right? That's his budget. That's not the final budget. But remember where we sit in America today. Okay, but that was him saying what's not in his budget that he has to present as they're building the final budget, which we are anticipating getting something sometime in the month of May. And so we're still out there, we're still hopeful, we're working, trying to strategize, doing everything that we can. But each and every one of us needs to rest in reality of where we are today in America with different cuts. And the question is, does the Department of Government efficiency have anything to do with it? Yes. Yes. Any other questions if I haven't been clear in response to you? Yes, Jim. So when you go into the payment management system, and the payment management system is where every person who has a federal grant will go into to draw down their money. And there is a new box on the screen where it does ask you to justify what that expenditure was for. And they're reading them, and if there's something in there, we mistakenly put in that we had a diversity training, they're not gonna pay it. Because there's language, there's words, there's things that you can't use. And so, yes, they are asking people to justify what the expense is for before the dollars will flow. Changes every day. I wish I could tell you that, Zuline. We're living in a world that somebody else is creating. You never know what is right. You think you said the right thing, and there may be one trigger. You don't know what's going to trigger it. Because there's nothing in there to say, we will not do this or don't do that. It's just explain. Okay, and so you don't have the information to guide you, you just are doing the best you can. Anyone else? So what you're hearing is we are living in a system that's becoming much more difficult. Okay, it's not an easy world to live in, but we're gonna do everything that we can to stay up and not fall down. All right, and we need all of you to help us with that. Number one, we talked about enrollment before. I have not had a chance to get and have meetings with people who are under enrolled to tell you what kind of decisions I'm gonna have to make, but I'm gonna have to start doing that next week. All right? Any other questions before I run? Yes, Sulie. Sorry? For Head Start's 100%. If you have 80 slots, you need to enroll 80. PFA, I'm moving it to 100%. Why? Because we're underspending, because we're doing the 80, which means we're already under 20% on everybody's grant when we do that. And so the new language is not going to say 80. It has not served us to do that. Yeah, and we're going to see it across the board because it's not serving us to say it's okay to be under enrolled. And that's basically what we've been saying. Okay. Yes, ma'am. Yes. Yes. Correct. That's the same across both grants, federal and state, that people are suffering with staffing. And we have to justify the rationale. But at the end of the day, the rationale isn't going to go far because of underspend. There's a methodology for the feds. I will tell you, for in some regions, they just swept the money back. If you're enrolled at 80%, they took 20% of the money back, live there. And so that means rooms are gonna close permanently, right? And so what we're trying to do is keep the opportunity to have rooms open by moving slots where there are children so that we can make sure we can hold on to it. For PI and PFA, they are on me seriously about underspend, and underspend is what's happening because we're understaffed. They understand that, but what's the plan? Okay. And it was yesterday. We're gonna be working with you, and I know that Angel's been meeting with folks and talking to them about doing budget revisions, et cetera, and we're trying to be as flexible as we possibly can to show how we're using the dollars, because we gotta use them and not lose them is what we're trying to do. Okay? Yes. Yes. But our question is, home visiting is revolving door. Programs are revolving door right now, regardless of model. And so we're gonna be I'm looking backwards to see where people have been and then strategizing to see where we can go before we make a hard decision. But some hard decisions are gonna have to be made where we've just been under enrolled, period. Where I've got other classrooms where there's a wait list. Because I can't justify a wait list in this program and under enrollment in this one. And so that's what we're working on. But we do understand that there are places where you can't fix the problem, right? And there's going to be that repetition of I'm in, I'm out, I'm in, I'm out. But as long as you're getting them back up, they go down, then you're doing your work, you're doing the best you can. And we recognize that in your enrollment pattern. But when that enrollment pattern hasn't ticked in the right direction, that's a different story. Anyone else? Budget revisions due yesterday? But May 15th, isn't it? Yes, okay. See, I was gonna say it, they looking right at you like, if I tell a story, fix it. So it's May 15th. All right. Any other questions before I run to my car? Anyone? If there are leftover questions, I've got Stan here, they will take your questions and I can respond later. But I just want to thank everybody for everything that you're doing. I understand how hard this time is on each and every one of us, but keep your head up and know that people are doing everything that they can to fight this battle on your behalf. So just keep it, keep that smile up. It's gonna be okay, one way or another. I don't know how today. But we're gonna keep on working at it, all right? All right, thanks, everyone.
Hi. They give me a microphone again, will they never learn? Okay, I don't have a big slide for you for just a moment. I wanted to just talk to everybody and say, we are trying to get our end of the year information together. It's already April. We have a lot to do over the summer. We're setting up for the new year in terms of information systems and everything. With the exception of any new children who enroll for the summer, we should have all the information about your kids now. In your PFA and PI spreadsheets, there is end of the year information. We're close to the end of the year now. You can fill those out. You do not need to wait. Please don't. Similarly for the Head Start for the PIR. The columns is parent status at the end of the year, insurance status, and so on. It's time now to put that stuff in. We're trying to put this thing to bed early summer again, except for new kids. The August 31st is my deadline to submit the PIR. It is not yours. I cannot do 50 of them in one day. So you need to do them more or less now. So a lot of people have been working with it. We've seen big progress. And I thank everyone for their cooperation, which is great, which is why I'm gonna single some people out. Sorry, but we have anybody here from AS McKinley? Please do your PIR. Literally, everyone else has done this. We need the enrollment status for all of the children. It was 72. This is last time I looked. That is the vast majority of the missing information in the entire city. Please do it this week. Thank you. Anybody here from Salvation Army? Okay. We have not been able to report one single person as enrolled in PFA or PI this year because there is not a single line on your spreadsheet where all of the required information is still. So your enrollment with this, with CPS is 0. Has been 0 all year. Please complete that by the end of the week, which is tomorrow. Okay. That's what I have to say. Everyone else, thank you.
So let me tell you the importance of why he stood up and called out the names of the agencies for the PIR. It's because I'm getting bombarded with, I can't fund you because you don't have this information for their children. I need that information in that PIR. It is imperative in order for you to get funded. There was a question up here where somebody asked what things might they have in a system where they ask you to explain. I'll give you one. I got budget revisions this week. Somebody actually wrote DEI in their budget. No, can't do that one. Where you may have had training before, I can no longer have that. We call that now professional development. You understand what I just said? No more training. Erase that word from your memory. We all call it professional development now. Whatever they want us to be, that's exactly what we're gonna be. Okay? Yes, ma'am? So I find this out by trial and error when they say my report is rejected. But I just know them two off the top of my head. Another one. We have already studied for the city. We do not pay for buses for field trips. Do not put that in your budget. Please don't put that in your budget. Admission, yes. Buses, no. Because sometimes, not that I'm in a rush, but I just feel like this is a good agency. They know what they're talking about, so that's just what you want. And then it's rejected. Dang on me. I love it. Go ahead.
You say you don't pay bus, that's not a PSA.
We don't pay buses, period.
On the paperwork, it states.
That's generic.
Girl, talk to me now.
That's generic. Because there's some things on there that says meds and drugs. And sometimes agencies copy and paste. And I just say, no, we don't want to put that with the drugs.
Or something.
Yeah, we don't want to. And you all, if you guys ever have a question, so I'm Angel. If you guys ever have a question, let's talk. I'm gonna tell you the correct way. And so sometimes I may say, can you call me? Like I'm gonna do with Miss Russell from Trinity. Let's just talk offline. You got to take on Campbell, I need to see you afterwards. Let's talk offline. I need to talk to you about something, Campbell. Thank you. Go ahead.
I'm just listening.
Oh, yeah, but anything, just give me a call. This is from my ECBG agencies. Y'all did good. I sent out a capacity email with Hassan capacity. You guys sent me what your capacity could be. Let me say this now. This is just for ECBG funded agencies. These are my state agencies for PFA and PI. Let me tell you what I'm looking for. Now that it's not in the email. I need to know that you have those children at your site. And that if I call you on Tuesday, when I'm back at work, you can put them in CSD cares. Now, the bad part for you is, that means when I talk to you next week and you say yes, I'm going to initiate a budget. that said you're gonna have to spend this money by June 30th. So I need y'all to be very clear. If you tell me yes, and you're gonna put the kids in CSD cares, you gotta spend my money. Cause I will call them back. As some of the ECBG agencies already know. I'm begging y'all. Let's be creatively, legally right. We're spending all this money. No year's ever a good year to leave any money on the table. But this year is the absolute worst year to leave that money on the table. This year is the absolute worst year to leave that money on the table. Hold on, what minute again?
Money on the table. And what if you all have sites that can't fill those spots, but you are willing to give sites that don't have PI slots, so you can't spend that money, because I don't spend it like it's a day.
So unfortunately, I cannot fund you
Like that, nothing.
for a funding stream that you don't currently already.
What do you think?
So
Creative, legally, you know, spend that money.
we are, that's why I'm having these one-on-one conversations with the agencies, because sometimes, okay, so perfect example, doula. So I'm on doula hard. Doula, help me doula. And they're like, yeah, you gave me the contract late. That's so true. I really did. But it's not me. So now what we're gonna do? We're gonna get creative with our care bags that we're gonna prepare for our moms, and the strollers that have the stroller and the car seat. And then some people are sponsoring baby showers so they can get their enrollment up. And I like goodies at a baby shower. I'm not pregnant, I'm just fat, but I'm just saying, if I was. So these are all acceptable things you can buy. So retention bonuses is the word you're gonna use. And it must be in your employee manual. One thing I have to warn you all, do not give a COLA. Do not say it's a COLA. COLAs come from me. You cannot give out the same thing twice in a fiscal year. So you know I don't have the money to give you a COLA. Don't mess me up just in case I get some, and I need to give you one. See how that works? Mr. McGee?
Check your facilities. Check your facilities and make sure, look at things that might be broken, might be in disrepair, or might be time for an upgrade. And that's another avenue for you to spend some money as well, to make sure your facilities and your playgrounds and things like that are fully up to date. And if you had to take a picture of them, put it on your recruitment flyer, that's the playground, swing set, et cetera, that you want to show parents about why that you come to your center. So just do that as well.
Yes, ma'am.
I don't know about that, Ken. Because, certain facility things are not being taken as something that needs to be done for the center to, in its great health. It's being taken as a upgrade to your facility or upgrade to your building.
Give me an example.
Okay, concrete. So we needed new ramps for the beds to go down. We got new ramps. And those evacuation cribs
Yeah.
to go down and ramp. They told us, they initiated, they first said, no, we're not gonna finish. That's an upgrade to your building. And then went back and forth, okay, give me a percentage, what's your percentage? And they only take a percentage of it, but we were out of that money.
That is true.
Yeah, I mean, because you're also operating a program in the building as well.
Yeah, well, it was only their portion because that was for the, it was for the rent.
So for rent, it was just for your SR, PFA, DHS people.
It was free, it was allocated about both different programs.
So it was DHS and PI or something like that. And then you'll charge 100%, even though you know that's the only groups that 0 that you're serving.
So in this example, they were doing a grant for the 0 to 3 beds to come out. When Sorrento went to see if she could get approval for 100%, Sorrento was told, no, we can only give them a percentage. Well, by that time, this agency had already spent the money. And so they were out the difference of what we could give them versus what they actually paid. So that's why I said, call me, let's do it first before you do it.
This one line, before your May 15th budget revision date, that's the discussions you want to have. But then, again, you want to talk to Anthony, you saying, but you want to look to make sure that you're looking to see what you need to do. And also recognize that there's any other dollars that should be, that could be supported because they're operating the program. In your instance, that just is a little different, given if you're just doing different frequent those particular things only. My question would have been to somebody, then where's the other, what's the benefit? That would have been the question. Just honest.
I mean, they said no at first, and then we went back and forth and then we had extras.
So she asked for ECBG program, so I'm gonna say this meeting is recorded, and my phone number is 708. Go right there. 224-6434. 708-224-6434, and that's my cell. And I do work better with text. I'm not good with the phone. My granddaughter has it on work mode during the day, so it doesn't ring. But I do hear text for some reason. I don't know why. Okay, so don't say nothing. It may take me a couple of minutes to get to the text because I never remember where I put my phone. But I will answer the text right now. I will respond. If you need to answer, call me. Look, yeah, that's true. That's true. She's on the phone. Everybody's on the phone. Yes, sorry about that. Yes, ma'am. That's what the young lady from finance said, yes.
What was the question?
Oh, sorry. She asked, was ECBG budget revision due May 15th? As long as it's in your handbook. Okay, so that was a crazy, so that's another thing. When you all are doing the retention bonus part, it goes with salary and fringe.
Right.
And I'm saying this because I got a budget that I have to send back. I'm going to approve it. It just needs to be in the right line. So just remember that when you all do that. It goes at the bottom, like when you guys do COLA. Just put retention bonus and then what that dollar amount is.
Okay.
If you do a budget revision, yes.
But they have to include the spreadsheet, right?
Yes,
Okay.
because they're gonna ask you which team, yes.
So another question.
Yes.
What kind of language do you need to put in there? You need, okay.
So when you call that number, that's the number you're gonna text and it says, send me the verbiage. And don't say nothing, okay? Okay. Okay. I'm sorry. Any more questions? Or concerns? Okay, got you. Put your name in there, so I know. Okay.
She doesn't have her phone on her though.
No problem.
Oh, apologize for bombarding your way onto the agenda. How dare you work at work? Didn't I tell you something? We're trying to be respectful of time. We're due to end at noon. We may run over maybe about 5 minutes, if y'all okay with that. We're gonna run through these slides real swift. Good morning. My name is Sheree Johnson. I'm the manager of program operations and quality. How are you? Great. Love to hear from you. Good to see you. I have a couple of updates. So this is a repeat from last meeting. Sareka already mentioned the Chicago Early Learning application did launch on April the 8th. Just sharing this once again. You are welcome to share this plugger with your families, have it posted. If you scan that QR code right now, you'll be launched into the Chicago Early Learning platform where the application is housed. Also, Save the date, DFSS's, that sounds weird. The Department of Family and Support Services will be hosting it says in-service, that's wrong, it's a pre-service event, August 19th through the 21st. I put wow there because, yeah, we early, I'm proud of us, wow. Additional information will be coming soon, but again, we wanted to let everyone know because we also know that you are hosting your own pre-service or in-service events. Please try your best not to do it at the same time because we want you to be there. We want you guys to be with us. We want you to participate. Again, additional information will be coming soon, including how you can pre-register, et cetera, et cetera. Any questions on anything on this slide? Great. Moving on. This is kind of tiny, so I'm gonna read it to you. Oh, go ahead. Yes. PFA, PI typically starts the same day as CPS. CPS starts on Monday, the 18th. Monday, the 18th. Oh, this is great. August the 18th. That's the same week that CPS starts. I know it's interesting. We're trying our best to do things at an interesting time where spaces are available, 1. 2, we're also trying to do things prior to federal programming start first week of September. So that may cause a slight conflict. We understand that. But CPS programming starts Monday, the 18th, which means that's when PFA-PI also starts. And Head Start will be after Labor Day per usual. Yes. The questions. I know. Thanks, Letty. That's the problem. I know. So again, we're trying to let you guys know these things ahead of time so that we can properly plan. If you want to divide and conquer, have some staff go on the 19th, some go on the 20th, some go on the 21st. If everyone wants to come, that type of thing, because we know that it might be a struggle since it's the first week of programming, we understand. We have class observations that are coming to PFA PI programs. So this is your heads up that our partner at National Lewis will be reaching out to PFA and PI programs to sign up for these class observations. So again, on this slide, you're going to see the 3 areas that will be assessed: emotional support, classroom organization, and instructional support. We know that Itters and Eckers focuses on environment